The Killer Growth Podcast starts now.
All right, guys, I'm Sam McVeigh, host of the Killer Growth Podcast, and today I have Jason Garraway with 316 Health. Thanks for being here.
Yeah, glad to be here. Health insurance.
316
Health insurance. Yes,
insurance.
There you go.
Yeah,
there you go. Yeah.
They don't care about your health. They just care about your insurance.
That's right. We're just evil, money-hungry insurance people. Don't you know that, Samuel? Come on now.
Yeah, stop stealing my questions.
Sorry,
That's one of my questions. This is like Exposed 316.
Yes, sir.
Episode.
I understand. Yeah, sorry. Yeah, gotcha.
Gotcha. So we start real easy. I want to know Jason's story. From college to what brought you to 316 Health.
Man, how long is this podcast?
It's an hour.
An hour long? Man, you need the short version.
I need the short version, and then we're going to talk a lot about this little synopsis.
Yeah, that's good. So good. So, born and raised upstate New York, Syracuse. So I was born and raised. Got a couple of brothers, one a little older, one a little younger. So I was the middle kid, always slugging it out, trying to, just find his way. Was raised incredibly, if you find like Christianity, and then you turn right, you find the Baptists. If you turn right, you find, the Southern Baptists. You turn right, you find the Independent Baptists. You turn right, you find the Jack Hyles Baptist, sort of Lord Baptist. You turn right, you find where I grew up. So,
wow.
So I knew that my whole life, Christian school, Christian education, felt the call to ministry at a young age. And so, so went up going to a college down in Oklahoma City. I got a degree in theology from a non-accredited.
Got to come from the East Coast to the Bible Belt.
Well, the Bible Belt, yes, to get that. So, so started there. Never really had the expectation of business. My thought was always, ministry is just where I'm at. I've got this wiring in me that likes to be part of. Just being a transformational piece in people's lives. And so thought that was going to work out in ministry. Well, then I get my early 20s, was in Southeast Kansas in a little Baptist church, and got married along the way, had a couple of kids, and just found out that ministry just wasn't my jam. And so I thought, my gosh, what's a guy from New York with the gift of gab, a non-accredited ministry degree, what in the world does he do? I know, I'll go sell something. So I answered a newspaper ad, got me in the insurance business in 2003.
Really? A newspaper ad?
Yeah, newspaper ad. Yeah.
You're like,
print
I could do that.
Advertising, which, I can smell the prints in the space that we're in.
Yeah.
So that's me, starting the insurance business, and along the way, just picked up a skill set that very few people seem to have. And here we are 22, 23 years later. Got a beautiful wife named Jenny. We've got 5 kids together, that range anywhere from 18 up to 27, a couple of grandkids. And so I still love to have fun and talk smack, and obviously hang out with weirdos like you.
Yep.
So, yeah.
Yep. You're going to fit right in.
I am going to fit
just
right in.
Just a couple weirdos.
100%. Yeah.
And jeans.
You got better hair.
You've got socks.
I have socks.
Yep.
You do not. Yeah. So that's.
So let's talk about you went to sell health insurance, but were you a employee? Were you a 1099? Was it your own thing day one?
Yeah. Great question, because I had no clue.
Yes.
I had no clue. Thought that I was an employee, and actually was a 1099 contract laborer.
Okay. Yeah.
And I got
a
my
month later,
I got my 1099, and they're like, holy crap, look at how much money I made. And then my accountant went through and realized we had to pay taxes and count mileage, and realized my 6-figure salary I thought I made was closer to 40 grand, which of course I didn't tell my buddies that. I told them I made, 6 figures. I'm making doctor money. So there was a period there of about, 8 to 10 years where, yes, I worked for a company, but yes, I was a 1099 contract laborer, and just kind of learned the ropes that way.
Yeah. So it was essentially just a contracted salesperson. Mm-hmm. Yeah, that makes sense.
Yeah, commission only, sink or swim, fight or flight, which is crazy. So I answered this newspaper. I've got 2 small kids at home. We are broke, Samuel. Kraft macaroni and cheese broke. I'm 20, got 23, 24. So I answered this newspaper ad. My father, I'm shocked he let me get away with it, because I would look at my own son that wanted to do the same thing and say, heck no, go get a real job. But I went to work for a company. The guy who hired me gave me $500 check for 3 weeks, which I thought was great money back in 2003. I thought that was fantastic. And after that, it was sink or swim. If you didn't sell, you didn't eat. And so I remember my first week out of training, for 3 weeks, I'm practicing, listening to sales pitches. And I remember going to Garden City, Kansas, sitting in a hotel out there and practicing my pitch in front of a mirror to make sure that, I could deliver the goods when I was.
Wish we had that video.
Oh gosh. Oh yeah. Yeah. I had the arms moving and everything because I'm New York and you can't talk.
Yeah.
I mean, this microphone's kind of getting in my way. It's holding me back.
Yeah.
So anyway, I remember my first week out, I go to Marion, Kansas, about an hour north of Wichita here. And I got a stack of leads, go into this trailer and sell $3,500 worth of insurance, made about $1,500 in that one meeting. I called my wife and I said, sweetie, we can buy groceries because I just made $1,500. And that was my launch into the sole proprietor, kill what you eat, commission-based world back in 2003.
So talk about 8 to 10 years of that. Then when did you decide I could do this myself? Not under because I'm assuming you had to connect with these, you to become your own broker was probably a transition.
It was
versus just selling. So talk about that transition,
100%.
Because that's when you decided 316 Health, right?
Kinda.
Okay.
Kinda. So, here I am, 23, trying to figure out where I fit in the world. Right, my whole identity of what I thought I was going to be in life is now shifted. For the first time in my life, as I started making some money, I began to realize that I could live a little bit. And having grown up as far right as I did, right, there was a sense of there are things you can do and there are things you can't do. And if you
Freedom.
Can't, there you go. And if you don't do them right, and you do them, all of a sudden you turn into a puff of smoke and a burst of flames.
Right.
So
lightning.
Yeah. So I started. Here I'm 23, 24. Start making some money. Started having a little freedom, taking what I wanted when I wanted. And at first, that mentality doesn't strike you as being maybe negative. But you start living for yourself and focusing on yourself and doing what you want to do. It led me to a place in my life 10 years down the road that I never thought I'd wind up in. If you looked at what my life looked like growing up and walking the straight and narrow, so to speak, and here I am 10 years down the road after making some money in the insurance business, and my life looked very, very different. And so in 2015, God made a big change in my life, huge. I had an experience at a local church where I finally ran into the fact that God truly loved me for who I was, and in that moment that I experienced that, looking at my life and the things I was involved in, my mindset, I realized that God loved me for who I was. In that moment, there wasn't an ounce of shame. There wasn't an ounce of me feeling like I'd let God down in some ways. Instead, it was a moment where God actually showed me He loved me for who I was. And that was transformational for me.
Remove the performance aspect.
Yeah, 100%. So no longer
powerful.
is it if I do these certain steps, I must be accepted by God. And if I don't do these certain steps, He wants to turn me into a greasy spot in the road. Instead, I realized I had a Heavenly Father who loved me for who I was. And while He didn't condone necessarily how I was living, He didn't measure His love for me by how I could perform. And so that was 2015. God made some
There's that New York preacher coming out.
There you go. Let's go. We're going to pass the plate. We're going to pass the plate next. We're going to, and the Lord said, So that was really pivotal for me because it anchored me and started to anchor me into what my identity is. And I think the first step that every single person has to figure out as they work through life is what their identity is. And where is it anchored and where is it rooted and who am I really? I think that somebody said many, many years ago, know thyself. I think there's I don't know who said that, but it seems like it was a really long time ago and somebody really smart said it, probably from New York and maybe Italian. So that started me on a different journey. From 2003 to 2015, yes, I went and sold stuff. I don't know that my perspective was necessarily on how I can help people. My perspective is how can I make some money and how can I go enjoy life and all this new freedom. 2015, God finds me in a place where that freedom I thought that I had now turned into great bondage. And that experience with God showing me that He loved me for who I was. The very next thing He shared with me is, Jason, here you are in bondage to all these things in your life that were freedom. And I love you. And how in the world can you not serve me? Because I'm the true path for not being in bondage to those things. So So actually, at that point, I thought I was going to transition a career. Part of what I did in health insurance is traveling all over Kansas and eastern Colorado, selling health insurance to farmers and ranchers. Around the same time, the Affordable Care Act hit health insurance. If you're familiar with that kind of upended the whole industry.
That was the first time, I think I told you this, the first time a president did something that I personally felt.
Yeah.
As an employee at a small business.
No kidding.
When our health insurance freaked out. Not making a statement of the pros. I understand more of it talking
health
to you.
Health insurance is a mess. I don't care how you look at it.
That was the first thing I noticed. And I was young. I was like 20. Or what would I was like 25.
Yeah.
Yeah. I remember
you still
that
look
moment.
25.
Yeah.
I don't.
I am.
25-year-olds don't wear socks, man. Men wear socks. They just
not ashamed of these ankles.
Yeah. So 2015, trying to figure out what am I going to do? Realized that it's not good for my family life to be gone as much as I was. So I actually picked up a real estate license. And I thought, well, here's what I'll do. I'll transition from health insurance to real estate, and I can stay more local. And my wife had a good enough job that could kind of absorb that change. And in health insurance, prior to 2015, I was very, very lead driven. As a matter of fact, the company that I worked for would provide us mail leads of farmers and ranchers in the middle of nowhere. I would hire telemarketers to call farmers and ranchers in the middle of nowhere to uncover the needs that I could go solve and go out there and go sell it. So I never understood relational marketing. I never understood what it looked like to build relationships and long-term standings in communities. And so 2015, decide, I'm going to get a real estate license, transition from health insurance to real estate. And I realized that real estate works a little bit different in sales than what I had understood, which is here's your stack of leads, go call the leads and make some money. And I learned this idea of building relationships because nobody uses a realtor based on a lead. It's normally based off, hey, Samuel, who do you know that does real estate, right? Yeah. It's very relational. Around the same time, I had a buddy of mine named Robert Beard. Robert Beard's another realtor in town. You know Robert? Yeah.
I don't know.
He would be fun on this podcast. He would be, he's an Irishman. Yes. Yeah. You could probably drink Irish whiskey.
Shoot it in a pub.
Yeah, there you go. Artichoke. So he came along and said, Jason, I'm thinking about starting this new thing called B&I. It's a networking group here in Wichita. And I want you to be a part of it. I was like, dude, I don't want to be a part of your stupid cult, whatever.
Been there,
no, come on. So I said, well, here's the deal, Robert. B&I brings in one person per profession, and you're a real estate agent, and I'm trying to do real estate. How does that work? He says, no, Jason, I'll do real estate. You come in for health insurance. I thought, all right. So I started this B&I chapter called the Preferred Professionals in 2017, and I began to take the principles that I had learned in real estate, which is very relational, and I thought, what's it look like if I try that in health insurance? And starting that in health insurance, I realized that people really are stuck. I heard it from you a minute ago when you heard that's the first thing that I felt that was federal, and it probably wasn't positive.
No, not from my personal experience.
Probably full of chaos and confusion, and this is effing blah, 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 blah. So I began to realize that I had a skill set that very few people had in my industry that saw what health insurance looked like prior to the Affordable Care Act, now through the Affordable Care Act, and then post-Affordable Care Act. How do we really help people solve problems? 2018, my dad was diagnosed with stage 4 pancreatic cancer. And so I got a brother in Iowa, got a brother in Atlanta, Georgia. My folks had actually moved from upstate New York to Oklahoma City. So me being in Wichita, the middle kid, closest to him, every Thursday I would drive down to Oak City, and I remember walking with mom and dad through the journey. And my dad went from diagnosis to death in about 4 months. Dad was super healthy, never took a look at medicine, and everybody's healthy till the day they're not. And I remember sitting in the oncologist office in Oklahoma City as my folks were trying to figure out what the next steps were, right? They'd had the biopsy, realized it was cancer, and now they're trying to figure out what the treatment needs to look like. Well, my mother, who is the Italian of my New York Italian, my mom can literally speak with her mouth, her hands, and her feet all at the same time, and you'll know exactly what she means because she's wired that way. She is sitting in front of this oncologist, literally this far at his desk, and she is taking up all the air in the room. She's talking about, what about online here, and what about blood work there? And I saw, MD Anderson says this, and Mayo Clinic, and blah, 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 blah. Not even taking a breath. And this poor Midwestern oncologist is looking at my mother like, holy crap, lady, just take a breath. My father and I are sitting maybe 10 feet back on a leather couch. He leans over to me, and even though my dad was sick, he still had a fantastic sense of humor. He leans over, he says, son, there's not a single class that guy took in medical school to get him ready for your mother today because she is on fire.
That's awesome.
But the next thing he said to me has stuck. He said, son, I don't really care how we treat. I've read the prognosis. I've got a 2% shot of making it 2 years or more. I get that. I don't care how we treat, but here's what I know. And he pointed at my mother. He said, that woman over there is going to call every shot. We're going to go where she wants to go. We're going to treat how she wants to treat. We're going to do it exactly how she wants to do it because she's going to need a sense of control as we walk through this journey together. Well, that day, my profession in health insurance hit differently because now had my dad taken a cheap route, and my dad was cheap. I don't mean that ugly. He just, here's what I know about the generation a little older than me. They got all the money in the world, but they love a good deal, right? Mm-hmm. And so had my dad bought maybe a Medicare Advantage plan or something that was maybe substandard to save some costs because he never think he was going to use it, the last 4 months of my dad's life would have looked a whole lot different from my mom's point of view because she'd have been fighting with an insurance company trying to get access to care. Matter of fact, that whole thing came to light a couple of years ago when a guy in New York City got a bullet in the back from a kid because he was mad because his grandmother couldn't get access to care over a similar situation. But my father, because he had a good son, made some good choices. He did it kicking and screaming. Yeah. But my mom was able to get my dad the care that she needed, or that he needed when he needed to have it. So I wrote down at my desk going through that we are part of people's experience on the day they get the worst news of their lives. It sits in my desk. Matter of fact, I think next time you come, I'll show it to you. And so in 2018, my perspective changed significantly. And I thought, my gosh, how do we take a system that is stacked against the average person, the average small business, flip it on its head, and whether it makes us a commission dollar or not, we can help turn the lights on and help them actually solve problems. Well, from a business standpoint, I don't know if that sounded real good because we give away advice that didn't make us any money.
Right.
But what I found is we built trust. And trust, I've come to realize, is the currency by which the right business thrives.
Yeah.
So by 2020, every time my phone would ring, I would want to chuck it against the wall because I can't keep up.
Yeah.
Came across a business coach, Dan Kreis, who would be phenomenal to have on a show.
I think it's next Friday.
Is he really? Oh, man. I want to be here to heckle just on the other side of the camera. And so, that's where 316 Health Insurance was born. Understanding the flexibility that I had, not just as a sales guy, but how do I take all the different pieces in healthcare, whether it's direct primary care, level funded plans, the Affordable Care Act, Christian sharing programs, private plans off market. All these things are just tools, and how do we blend them together in ways that actually work for people? And what we found is in our niche, so to speak, is there's very few people that practice it that way. And so we had to scale, we had to grow because I can only serve so many people. Sure. So I had to create a business that could help us get there.
Thus 316 Health Insurance.
Thus 316 Health Insurance.
I got it right that time.
There you go. It's not 316 Health.
Right.
You got to put the insurance piece in there.
Does that work out into a phone
Please
number?
don't ask if we do P&C insurance. Please don't ask if we do life insurance. I'll say it's 316 Health Insurance.
Right. Yeah. No, that's good. So what I love, so the reason I wanted to have you on, you spoke at a Million Cups event. It was the first time I heard part of this story. And I just think it's really powerful. It's far and few and not dogging any other companies or anything like that. And not even just talk about your industry. It's rare to find someone that built something from a problem, like the origin of the problem, instead of just trying to get market share.
Yeah.
And so what I love about your story is that you were like, this could look different, and you innovated on a idea that really has a lot of constraints on how you can innovate. And the way you did it was, hey, whether there's a commission or not, we're going to find every possible avenue for this person to get what's best for them and their situation and their means. And then I sat down in your office with you and you broke down the Obamacare Act of how this can work for under 50 employees and people making under $20 an hour. And that I'd never heard it communicated that way. And so I thought that was just really powerful. And so I want to go deeper into the health insurance aspect if you're good with that.
Happy.
What is broken about health insurance?
Oh man. Yeah, smarter people than you and I, Sam. Well, smarter people than me, not you, have tried this and figured out. I don't care what insurance it is. It's all this idea of putting people in a risk pool and sharing risk with each other. It's kind of like the lottery.
Yeah.
We don't know who's going to get hit by the bus. We just know statistically somebody will. So everybody throws money into the medical lottery, right? Whoever gets hit by the bus is you all right there?
Yeah, I just had a little bit of
that was not me.
A little bit of a splashback on my coffee there.
This
little recoil on that sip.
Already crying about health insurance. I get you got me. Yeah, you got me real good. I used to go to networking groups and I'd stand up and say, "Hi, my name is Jason Garraway. I specialize in doing health." And people look at me like, "What's going on?" I'm like, sorry, health insurance leaves such a bad taste in my mouth, and that was kind of my hook, so to speak. So
sorry, I ruined that.
No, that's all right.
What's broken about health insurance?
So here we are. We got this medical lottery, right? And so there's this. The more people cash out of the medical lottery, the more people have to put into the medical lottery. So prior to the Affordable Care Act, the idea was, how do we find a bunch of healthy people, stick them in a big risk pool together, because the healthier the pool and the less it gets used, the cheaper the rates. And how do most people buy health insurance or any insurance? It's the rate. Can I get a better rate? Who's got the best rate? Does Blue Cross have the better rate? Does United Healthcare have the better rate? And the way you control rates is by controlling how much you spend out of your risk pool. Well, that's great as long as you're healthy. But what happens if I'm 52, lose my job, my wife has stage 4 cancer? Who in the world's going to go insure her?
Yeah.
Because she's a guaranteed claim waiting to happen. Now, prior to the Affordable Care Act, each state had a high-risk insurance pool but it would cap out at $100,000 worth of coverage, $150,000 worth of coverage, which left people that were really in a dire strait uninsured. So that was the problem prior to the Affordable Care Act. How do we provide this access to care for people who really need it, who weren't able to buy it when they were younger?
And that debt was crippling people's personal lives
100%.
And hospitals,
Absolutely.
right? I mean, it was bad for everybody.
Well, not just crippling hospitals, but if I'm walking in with stage 4 cancer and I can't pay, I'm not getting access to care.
Right.
It's one thing if I walk in and have a leg cut off and they've got to give me emergency care. But in the situation where it's not emergency care, we've got to talk about payment.
Yeah.
So the Affordable Care Act came along and said, how do we get these people access to care and provide no pre-existing conditions? Which sounds great. No pre-existing conditions, whether you're healthy, not healthy, come on in, we're going to take care of you. Sounds great. And there's an argument to be made that people need access to health care.
Yeah.
But as soon as you let these people join these risk pools without any type of penalty and charging them the same price that they charge healthy people, all of a sudden the usage of that pool has gone up exponentially. And in any health insurance pool, healthy people pay for sick people.
Yeah.
So then the Affordable Care Act comes out, and they try to penalize people if you didn't buy the Affordable Care Act, because they had to figure out a way to incentivize healthy people to buy into pools with sick people. And that's been the debate in healthcare. You can't have cheap premiums and no pre-existing conditions in the same sentence. To mask that problem, Uncle Sam came up with the idea of, well, let's just subsidize it with tax money. The less money you make, the more we'll give you federal money to pay for it. The less money you make, the more you have to pay for it on yourself. And that's been the debate in healthcare in the last decade or so.
Because essentially the rate's the same to them, but the federal government's subsidizing.
Correct.
So the healthy person's paying less.
Not necessarily. Income.
It's all based on income.
All based on income. So the premium may be $1,300 a month for a person. If my income as a single person is $20,000, Uncle Sam may be giving me $1,000 a month.
Right.
So I see like a $50 premium.
Yeah, so it's regardless of
There you go. Yeah. Regardless of health.
Yep.
And so that's the debate in healthcare. Now, you brought up a point earlier that I want to really dig into. For us to solve the problem, we've got to think differently. I think it was Albert Einstein who said the definition of insanity is doing the same stupid thing. I added that because it's New York over and over again and hoping for a different result, right? And we're there in healthcare, so we've got to innovate. We've got to think differently. And it's not just healthcare. I think it's in any business.
Yeah.
I appreciated the tour you gave me of what you're doing here. It's an old school bookstore, old printing press, newspapers from the 30s in there, but you figured out how to innovize. Is that even a word? We'll go with it. Innovize. Everybody knows what that means. Innovize something different and new to meet people's needs, which is fantastic. And I think that every successful business owner has to figure out how to innovate in his or her space.
And that is so hard to do when federally, like when the feds are involved, right? In health insurance now, that That I've heard that argument. The feds are involved now. So like, how do you innovate? Because policy is now involved. Like there's so much policy around it.
There is. But
yeah,
there's also incredible opportunity. Every time Uncle Sam sticks his finger in something and mixes it around, you know what it does? It drives people to shop. Now, I don't want to get dug into the politics of good, bad, or ugly, but I will say every time, and he just did this in the end of 2025, and hand subsidies went away. Everybody's panicking if you're watching the news. Every time Uncle Sam dabbles in that space, we make a crap ton of money because people are trying to figure out, how do I now solve the problem?
Yeah.
And the rubric, the matrix of how it works is always changing. So for people who are willing to stay on top of the changes and help their clients re-innovate and re-strategize and solve problems in a new way, there's a lot of opportunity.
Yeah.
Especially in my space, when those agents or advisors aren't driven by how do I make money, but rather how do I solve my client's problem? And something really cool happens when we focus on our clients. Everything else works.
And they tell other people.
If I take care of client, everything works. It solves my marketing problem.
Yeah.
It solves a reputation problem, solves my review. How do I get reviews? Everything is solved if I can provide an experience that makes people feel heard, seen, appreciated, and loved, and feel like they found an ally to walk them through something they could never understand before.
Yep. That's really good. Talk about what you guys do differently in 316 Health, saying, like, it's kind of a generic statement to say we care about them and we're going to fix their problem. Yeah. But like, how are you actually doing that?
Yeah, great question. So there's kind of three spaces we live in. One is folks who are 65 years in age and older. That's the Medicare space.
Okay.
We live in the individual insurance space. So folks who have to buy health insurance on their own, whether they're self-employed, they work for a company that doesn't provide health insurance, or maybe the cost to add mom and the kids to dad's health insurance is $1,500 a month. So we live in that individual space. And then we've really, over the last couple of years, bumped into the small business space. So the Medicare space is the easy one.
Which you would define under 50 employees?
Yeah, I would say for us, the sweet spot's 25 employees. It's the guy who's, maybe got a $2-3 million business, got 12 employees that is trying to execute his vision.
Yeah.
But trying to share risk with 12 people gets really hard. So all three of those spaces where we live, but the individual space is probably our bread and butter. And ultimately, even the small business space, if they follow our advice, incentivizes and brings people back to the individual space. So really, when a guy wants to buy health insurance on his own, you got 5 ways to do it. You could do nothing. And there are some people who say, rather than give Blue Cross $1,000 a month, I'll stick it in my back pocket and I'll cash pay as I go. Now, usually those guys are about 25 and single, all right? But as soon as they get married, their wife is like, yep, no, we're not going to do that.
Because if their parents have insurance, they're kicked off at...
Yeah, it depends if mom and dad want to pay for it. I mean, so that's option one. And it used to be that if a guy went that way, there was a federal penalty if you were uninsured.
Right? I remember that.
2.5% of your household income.
Yeah.
Now, if you follow politics, you know that during the first Trump administration, that penalty went away, didn't actually go away. What they did is they just zeroed it out.
So you still got a penalty, but it's zero.
Yeah, the penalty's still there.
So they could add it again.
Yeah, it's like Dad saying, don't cross the street. Don't touch. I'm trying to think of a good example of what Dad would say. Let me use something different because I'm choking on it right here. Much like you done in that coffee a minute ago. It's kind of like having a speed limit sign down the highway for 75 miles an hour and giving away $0 tickets.
Yeah.
Samuel, I drove here today in a 2019 baby blue Ford Mustang convertible. I would air that thing out as hard and as fast as I could go if they're giving away $0 tickets. And that's where the law is at right now. But if we take a hard left turn in politics and they bring the penalty back, so we got to think about that long term. Option 2 is I can play in the Affordable Care Act. Premiums are high. Networks are real sucky. Matter of fact, I had a phone call this morning. We've got a client that is with Blue Cross. Blue Cross is fighting with KU Med Center. KU Med Center just dropped out of Blue Cross's network because they're fighting over contract pricing. I got somebody in the middle of stage 3 cancer who has appointments at KU Med Center that now can't get access to care because Blue Cross is fighting with KU Med Center. That's the Affordable Care Act. It's where there's no pre-existing conditions, and sometimes that's important for people. And it's also the place where we shop, see if there's any federal money out there to help me pay for that.
Yeah.
Option 3, you can find some carriers that do things off market. There are companies who said, I wonder if we can figure out the legal loopholes to the Affordable Care Act, figure out legally how to tell sick people no and keep healthy people pooled together in risk pools. And there's some very, very creative ways to do that. But the problem with that is they get real clunky. They're very confusing.
Yeah.
And they don't satisfy the penalty. So if the penalty ever comes back, I could be buying $600 a month in health insurance and still pay the penalty. Yes, because you have the right type of plan.
How much was the penalty at the beginning?
2.5% of your household income per person in your household that didn't have the right type of health insurance.
What?
So if you're making $100,000 a year, you got a family of 4, you paid a $10,000 a year penalty for not having health insurance.
Yep. I did not know that. That's insane.
Yep.
Because that's the only way it could work. Everybody had to buy in.
That's right. That's right. That's how you shove them in there. And that's the fight over that. Can Uncle Sam force me to buy something? That's the whole debate over healthcare. Yeah.
Okay, sorry.
Yep.
You still have 2 more options.
2 more. Option 4.
Yeah.
You can do a faith-based program.
Okay.
So things like Christian Healthcare Ministries, Metashare.
That's what we had for a long time, personally.
Those are faith-based alternatives. They still do this idea of risk pooling, but they don't do it through contracts. They do it through memberships.
Right.
And if they ever run out of money, they're out of money. What makes them popular is it's actually compliant with the healthcare law.
Which I never understood, by the way. I never understood how.
Yeah.
But the problem with those programs, and I think they've changed since I haven't had it for a long time, but I had to go, and my wife hated it. Haley hated it because we always had to say cash pay, non-insured.
Depends on the program.
And then, we needed them to pay us. And that was specifically CHM, I think, at the time that we were using it. I don't know if they've changed now.
No. CHM says, hey, listen, I'm going to go negotiate the cash price. Hang on, doctor. I need about 120 days. Let me get your itemized bill. Let me send it to CHM, who's then going to pay me. Yeah.
And then we go to collections every time. And then eventually we get the check and we pay.
There you go.
And I think our local hospital started refusing it because
or making you pay up front.
Yes,
so just make you pay up front.
Right.
Yeah. So you float on a credit card, whatever you're going to do. Yeah. Now, what drove that market is the Affordable Care Act. One of the mandatory benefits or the minimum essential coverage benefits, the 10 benefits that every ACA plan has to have, is maternity services.
Oh, it was amazing at that, I will say.
Which includes either having a baby or in some cases not having your baby. Oh, so that created the loophole where folks said, hey, listen, we can't get behind that. That whole concept still divides the country to this day. Right?
Yeah.
So you can't just say I'm a Christian, don't believe in what the Affordable Care Act does and get around a penalty. But Uncle Sam said, all right, if you find that you can't get behind that, if you'll buy a Christian sharing program that's designed to share your medical expenses because of your faith, we'll exempt you from the penalty.
Wow.
So you have a lot of healthy high-incomers that go that route because they're compliant with the law regardless of their faith. But then we get into how does it work? Some carriers, you mentioned the OG CHMs, Samaritan Ministries, you got to cash pay everything, get reimbursed. Well, if you don't know what the hell you're doing, holy smokes.
Yeah. Well, on the CHM side too, like we had to sign a personal testimony.
Oh, yeah.
We had to provide proof that we
go to
were
church? Do you
Christians
tithe?
and that
Yes.
we were saved. And that was interesting.
Yeah.
I always thought, how is that legal?
So it's membership.
Right.
It's
So
it's
you
the
can have any
Wild West
rules.
right there
Yeah.
because it's not regulated by Uncle Sam.
Yeah.
And because they're not guarantees of payment, which means if they ever run out of money, they're out of money, they get really hard to use for big stuff. So sharing programs we can use all day for appendectomies, knee surgeries, ACL repairs. But if I get stage 4 cancer, and that's where they get nice use. Now, having said that, there's some other sharing programs a little more modernized that are actually built on the chassis of a health insurance network. So one of the ones we have a lot of our clients use is actually built on the First Health Network, which is owned by Aetna, where you give a card to the provider bills the sharing program pays the provider. So it's not all, don't judge all sharing program by how the OGs do it. So those, what we found is all of those choices have pros and cons.
Yeah, especially if you probably put a couple of them together.
Well, and that's the 5th choice.
Okay.
Thanks for taking my thunder right there. Appreciate that. It's good. You've heard this before, haven't you? Just stay in your lane. Stay in your lane, Samuel. Come on now. I'm trying to.
I've not heard the 5 things though.
Oh, yeah.
I've heard parts of it.
So the last option is what we call blended approach to healthcare. Okay. How do we take different pieces of this, blend them together in ways that work for people? For example, if Uncle Sam wants to give you $1,000 a month to buy health insurance and you can kind of predict your income, great. Let's leverage the Affordable Care Act, but it's going to have a lot of holes. The out-of-pocket maximum of those policies are somewhere around $20,000 for a family. which is still a big number. So what can we do in this non-ACA space, the ancillary space, to fill in the holes, much like folks on Medicare buy a supplement to pay what Medicare doesn't pay? Same strategy.
Yep.
And we package together some of those things. We have a lot of clients. We have over 1,000 households. That's what they do. We just got done seeing them in November, December, and early January because we got to see them every year.
Yeah.
And then we sit down with folks and say, Jason, we don't get subsidies. We're healthy. Regardless of our faith, we don't do dumb stuff. What can we do? Well, if your worldview fits, we can take a sharing program because there's some things to like there. We like that you're exempt from the penalty. We like that it's the cheapest place to find coverage long term. But we don't like it by itself because if I ever get stage 4 cancer, I need something more than that in my back pocket. And we take a sharing program and then fix that hole with other non-ACA space. So there's a lot of creativity that goes through there. And this last year, when enhanced subsidies sunsetted, you saw people, your social media blew up with people saying, oh my God, my insurance is going from $800 a month to $3,000 a month. It's not that the premiums went up, it's the subsidies went away for those people. And the healthy ones, we were able to lead them to think differently to get them out of the system by leveraging a different strategy. And that's what it comes down to in my business.
So the Affordable Care Act increases, because those are through other programs, like the jump there for anybody was because of what? Like, talk about that big, like in more detail. It's not over my head.
There's a double whammy last year.
Okay.
So we've got risk pools, right? Risk pools are based on usage. When we think about the Affordable Care Act, it tends to be full of unhealthy people and people with no money. When you look at the demographics of people who tend to use healthcare the most, who are they? People with low income who don't take care of their health for whatever reason, and people who are sick. So those plans are jumping by themselves 20, 30, 40% a year. In addition to that, this year, enhanced subsidies went away. And I've mentioned that a couple of times.
Yeah.
So when the Affordable Care Act first came out, they said, all right, we got to figure out how to help people buy health insurance because we expect the cost to go up. So they came up with this idea between 100% and 400% of the federal poverty limit. If your household income were landed somewhere between 100% and 400% of the federal poverty limit, Uncle Sam would give you help on a sliding scale based on how much money you made. What made it weird is you guess at the beginning of the year. So I'm here. I think I'm going to land right there, but then you verify at the end of the year. So if you get a raise, get a bonus, forgot about a side hustle that you had, go to the casino and cash out, and you land here in income, Uncle Sam says, wait a minute, Samuel.
Do they back bill you?
They do. They take it right out of your tax return. Hey, you told us you were going to make $80,000 for your family of 4 last year. You made $120,000. I gave you subsidies all year based on an $80,000 projection. I want some change back on your tax returns. So that whole thing's a mess, especially for self-employed people have no clue what they're going to make year after year.
Right.
So for 10 years, that's just how the system worked, from 100% to 400% of the federal poverty limit. And then COVID hit. We had all these people that were uninsured going into hospitals, and Uncle Sam said, we got to figure out a way to provide coverage for people so we don't have to bail out the hospitals. At least that's what we were told. So here's what we're going to do. We're going to take this 100% to 400% of the federal poverty limit. We're going to raise it exponentially, and we're going to open the floodgates for people to buy in the Affordable Care Act. And that was part of the American Rescue Plan in 2021. And we had that for a year. Then inflation jumps 15%. And Uncle Sam said, I know how we're going to help the American people. We're going to continue to pay these enhanced subsidies for the next 3 years, 2023, 2024, and 2025. It's going to be a 3-year runway. We're going to provide all this extra federal funding to people, even above 400% of the federal poverty limit. And that's just how we're going to help people keeping the economy going. But we know we can't afford it long term. Well, into 2025 hits, we have a change in political power, right? And one side of the aisle says, oh my gosh, look at the Republicans taking away health care. And the Republicans are looking at the other side of the aisle, said, this is a Democratic law and a Democratic runway and a Democratic timeline. And they fought over that crazy thing and shut the government down for 45 days.
Right.
So what happened at the end of 2025, not only did rates jumping because the risk pools are polluted, if I can use that term. Anybody above that 400% of the federal poverty limit that was used to getting $1,000, $2,000 a month in subsidies went away. And that was that hard crush that most people felt.
That was that big increase most people saw.
Was that makes did I dumb it down enough for you?
Perfect. I was afraid I was going to have to use, the famous Office line. Explain it to me like I'm 8.
Use him. Drawing
you have a lemonade stand, okay, Samuel? We got a lemonade stand. No, That makes a lot of sense. You know, you see it and then life's busy and you're like, man, I wonder what the root cause of all this is. And you talked about it at BNI all the time.
And we can unpack that for people and help them understand the why.
Yeah.
It takes away the frustration.
Right.
They begin to see it. And yeah, change is hard, but you know what? Change is inevitable. We have to change. We can't do the same old thing the same old way. And so again, as we sit down with folks and just help them turn the lights on, how do we take an industry that's dark, confusing, frustrating? How do we just turn the lights on, hold your hand, and help you self-discover where you need to go? That's just been the secret of who we are.
So your unique value proposition is truly finding the best solution, staying up with the times. I mean, you're networking into innovative pools and other carriers is really important too. And then just the honesty side of selling things. Do you sell something you don't make a commission on?
100%.
Yeah.
Mm-hmm. So direct primary care. We refer a ton of business. We can't do health insurance. We can't do primary care any better through an insurance model, in my opinion, than what a DPC membership does. You mentioned Christian Healthcare Ministries. We've directed people to Christian Healthcare Ministries at times because that's the right place. Matter of fact, about once every 2 years, they send me a cease and desist letter, tell me to stop selling their stuff. And I'm like, I'm not selling your stuff. I'm one beggar telling another beggar where to find some bread. That's all I'm doing. So, so there are places, we have various dental products. Some are very high commissioned, some are not.
Yeah.
And so we've just found that if we come alongside of people and help them make decisions, to help offset that, we also have a fee for service model.
And that's what I was going to ask about your membership. But I've seen that on your website.
Yeah.
I've seen you talk about it. Talk about what that looks like.
Yeah. So because we've got a strategy at the end of our conversation, it's not one piece of the puzzle. It may be 4 or 5 pieces. And while people make informed decisions while they're there, oh my gosh, you walk down the road after 6 hours, you're like, what the heck did I do? Who does what, where, and how does that all? So we tell our clients, we can have 2 different buckets we can put you in. We have some clients say, Jason, sell me some products and leave me alone.
Yeah.
I will deal with this on my own. I will deal with carriers on my own. I'll figure it out. Great. Every time we see you, we will deal with you transactionally. We have very, very few clients that do it that way. And then we have clients say, Jason, here's the deal. I understand this. I understand how it works. I love it, but I'm going to need some hand holding and some help to leverage these tools properly as I walk through my health insurance journey. We have a membership model for that. It's $39 a month. It's a broker advocacy service, and it connects those people to our company long term.
Yeah.
And it puts us on their side to use those tools properly. I don't care what tools you have. They may change. They may adjust. How do we do the Affordable Care Act? How do we know which cards to pull out of our pocket at which places? Sometimes we don't want to give the cards to the provider because sometimes these ancillary policies pay out more, than what than the bill. And if we know how to do it right, we can do some really, really cool things. And if we have time, I want to share one story that we're able to do that with.
Real quick, talk about an example of how someone's using that membership. Like, give me a day in the life of someone has a scenario.
Yeah.
How is that membership of value?
I'm going to put both of those together.
Into this story.
Yeah, just let me run the show, man.
Yes,
I know
sir.
what I'm doing here.
Guys, it's been great.
I keep hitting
I'm
this
Sam
thing.
McVay, I'm out. This is now the Garraway
podcast. Yeah, this is the Garraway show, baby. Come on now.
These
Listen, did you not get the cue cards I gave you? Can you not pay attention?
I thought we had. It was best not to open that email.
Who reads emails?
Right.
We had a lady refer to us. She was a nurse practitioner, healthy as could be. Moved into private practice as a traveling nurse practitioner across different places, contract labor. So, healthy person. She actually wound up going outside of the Affordable Care Act because there was no federal subsidies there. Used a sharing program and some non-ACA pieces, kind of blended them together. Worked great. She came to us. It was in November a couple years ago. Sat down in our office, and she and her new husband came in, and I could tell the moment they walked in that there was some bad news that they had to share. She had just been diagnosed with a very aggressive form of stage 3 breast cancer, and they were just panicked, didn't know what to do. How do I do it? So we sat down with them. Because the Affordable Care Act has no pre-existing conditions, we immediately enrolled her into a Blue Cross Blue Shield Gold plan that went into effect January the 1st of the following year. The sharing program that she had and then some of the ancillary coverage she had, we also kept those in place because those would still pay if we played our cards right. So as she went through care, she used her Blue Cross card, front and center. slapped it down on the table, worked it that way. The providers billed Blue Cross paid the providers. But we also, through our team and through our membership service, we have a claims department who helps people file claims manually. So at the same time, we took those itemized bills or super bills, and then we submitted them manually to the other places because those products do pay in full regardless of any other insurance. Now, primary plans like Blue Cross, United Healthcare, they'll fight over who's primary, who's secondary, but when you go outside of the marketplace and you play your cards right, you file. So when it was all said and done, she received close to $280,000 worth of extra cash that came in from these other plans on over and above the bills that she received from treatment with Blue Cross. In a last-ditch effort, she went to Mexico to get some treatment for about $250,000 to help save her life. She fought valiantly, fought hard, eventually passed. But that's a situation where our agency, it's more than just what products do we sell. We're able to walk alongside of people on some of their darkest days, and the last thing they have to worry about is, oh my God, can I get access to care? And this woman and her husband were able to go where they needed to go, do what they needed to do, and not worry about, is the health insurance going to work, because we had professionals walking with them through the journey. And so our staff walked with them. She had communication with us. We helped her navigate things, get pre-authorization, file them manually, and make sure everything paid like it was supposed to pay.
And the powerful part about that for them is there's probably a lot of, going to Mexico regardless, even if they didn't have that money, that's still a hard decision to spend all that money not knowing the results. But it's a lot easier to seek innovative care or experimental care when you're not worried about leaving a mess behind your family, debt. That's super powerful.
That's awesome.
Yeah.
So our testimonial page on our website is full of those types of stories. People who walked away and said, oh my gosh, the last time I had a baby, it cost me $6,000. Since I used 316 health insurance, I actually made $6,000 because they know how to take a primary plan and beef it up in the place they're most likely going to use it, so we can take a system that's already designed to screw people, flip it on its head, and actually use it for something good.
The degree of separation, I think, is really important. There's a lot of middleman business concepts that I don't like, where there's someone in between a carrier, historically or in my mind, I think but in that situation, a carrier does not want to help you at all. They want to pay as little as they can.
That's right.
And so having a degree of separation of representation to figure out how to leverage that for their benefit, I love that. It is a great, and for $39 a month, that's a great value.
Oh yeah,
it's a peace of mind. You're getting people that live in this.
I priced that. No, I'm not a business guy. I'm a salesman. I'm a New Yorker. I thought, what did I price that at? I've never lost a deal over $39. That's exactly how I came up with it, and it's stuck. We have close to 1,000 families that's awesome. And what that does is it allows us to operate outside of being stuck with commissions. So whether it pays us money or not, we have figured out an innovative way to create a business, a system that walks alongside of people that's not held hostage to what insurance companies want to pay us.
And that's the beauty of it.
That's innovation.
It's completely outside of it. It's you essentially create a new market, if you will, of, hey, have you ever thought about hiring a consulting firm that consults on all your health insurance needs? Yeah. I love that. Well, I'll end with this because you have a meeting at 11 you have to get to, so I'm going to respect that.
That's all right.
But I love your story, respect you a lot, and I've only known you for 5 months. I started coming around to BNI. But every time I'm around you, I learn something. And you cross the line all the time, right? You're the guy.
What are you talking about?
You're the guy you're the elephant in the room every time.
About?
And that's not
I don't know what you're talking about. Would never cross the line.
I was raised by a gentleman. I don't even know if my dad listens to this podcast. I was raised by a guy who does the same thing. And, but I appreciate people like that unashamedly and unapologetically.
You're gonna see what you get, man.
This is who I am. I'm so sorry. You should probably just not be around.
I know.
But your communication skills are very impressive. I love watching how you communicate. I love watching how you communicate to a larger group, one-on-one, to a few people.
Yeah,
and I just want you to know that, like, I'm always watching you and learning.
I can't draw worth a crap. My artistic skills are terrible. I can't draw stick figures that look right, but God did give me the gift of gab. So there is that. Yeah,
and a lot of people with the gift of gab, I can't stand, right? And you have, and I love hearing your story of that big life change in 2015. Because I think there's something when someone has a gift of gab, but they genuinely want to help people, and they can jump into a position of humility of admitting when the gab gets the best of them, right? And I've seen you do that already a couple of times where you go, you become self-aware and you're like, oh yeah, too far. No, I've got to back that off.
Yeah.
And that's what people, I think that's a gifting set for people to make serious change, keep being unapologetic,
Well, thank you.
And know at your core, you do care about people
100%.
and you do love people, and you're building a business that is changing lives. And
It is.
I love that. It's
really cool.
I'm glad you're around here. I'm glad I get to be around
That's
you.
what do you know? Yeah.
But yeah, thanks for coming on.
Yeah, thanks for having me.
Appreciate you.
Yeah.